right. Episode 3.
Yes.
How exciting. This
I
is
know.
fun. I say the same thing every podcast, I think. I'm like, how exciting. It's just going to be like a repeat of what we said last time on. So, how was your day?
It's been good.
Yeah?
Mm-hmm. Yeah.
I just posted about it, but I reorganized my entire pantry and it gave me life. Like, I love reorganizing everything and lining it. Like, it just makes
It feels good.
so good.
It feels really good. I did the same thing.
I know. And I'm just totally going to say this because I don't care. But it was so funny because I was like looking through my stuff, like throwing out expired stuff. And I was just like looking at some of the dates and I was like, 2017, like this vinegar in there. And I'm like, oh, what is this doing here? So anyways, that was funny. So that felt really good. And just kind of like going through things and like getting rid of things that you don't need.
Oh, yeah.
Did you ever watch that Marie Kondo?
Oh, yes, I did.
Like if it doesn't bring you joy,
yes,
then just get rid of it.
Yes.
I literally
you
tried
were like
to
her.
have that. Yeah. I'm like, this vinegar from 2017 does not bring me joy. Let's get rid of this.
This is going out. It might bring you something else.
Right? Yeah. No, so it was pretty good. And then you were just with the girls, right? You're playing with...
Yeah.
Did they build forts today or was that yesterday?
That was yesterday. So these girls are they have really great imaginations. They do. Like if I'm busy doing something, they are either dancing, running around, building forts. They have like all their animals.
Best, like literally they do. They have the best imagination.
Yeah.
Like remember like there was like an egg. I literally remember this story. Like if it was yesterday, but it was like a couple years ago. And he was like, this is Dorothy's dog, Toto. And it was like the way she like had this huge imagination. I was like, oh my gosh, it's so cute. But yeah, good mama.
Yeah. Oh, thanks.
So today it went by really fast, but I was like trying to organize and do paperwork and all of that. We are kind of in the middle of all of the craziness. Yeah. The coronavirus and all that. So definitely trying to stay safe and wash our hands and bring calmness to our house because there's a lot that's going on the outside. So
yeah, I agree.
Yeah. Anyways, so you just got back. You guys got back, what, 2 weeks ago from the sensory training?
Yes. So we, some coworkers and I took the Star Institute sensory training for school-based therapists.
Where was that at? Was it like by Sacramento?
It was up north, by Sacramento. So it was a little bit of a road trip for us. It took us like 3 hours to get there. And it was a 2-day conference. So
good. Yeah,
it was really comprehensive. And it was really actually fun to go with, there was actually 5 of us, but 4 of us drove together. So
I was so bummed that I couldn't go.
I know. You were the only one on our team who didn't go.
I know.
But I love going to conferences with coworkers.
So fun.
Yeah. And it gives you some time to kind of bond. So we were able to drive up together and then
you guys made dinner. Did you guys make dinner?
Yeah. So we did an Airbnb near the conference. And one night we went out to dinner and the other night we had stayed in and made dinner together and just had time to just kind of hang out and then even kind of talk about some of what we learned from the conference. But you know how 2-day conferences are. It can be exhausting.
Oh yeah. It's so funny because you'll be sitting there and then like they'll give you like your afternoon break and then you go into the restroom and you're just looking at yourself like, how do I look this tore up? You know what I mean? Like I was just sitting there like it's so tiring though. And then if there's a lot of like really comprehensive information, like you're trying to wrap your head around it. You're trying to like figure out who you're going to apply what you're learning to.
Yes.
And then and then you like want to buy all their resources because they probably have a ton there.
Yeah. You know, one of the things that they did for this conference that I haven't had before, and actually I really enjoyed, before the conference, they had sent out links of some modules that you had to do before you went to the conference. So it was reviewing like basic, it was a review of like basic sensory information that you may or may not remember, if you're applying it already or not. So it was a really good review of like basic information that you need to know before you get to the course.
I like that. So that we can focus a little bit more on on all the other details.
All the good stuff that you really want when you go to a course. So I haven't had a course that has done that yet. And usually, that's like the first morning, like reviewing all the basic information.
The theories
so that
and
was
all that
nice.
stuff.
Yeah. So that was 6 hours beforehand.
Wow.
Training.
And as it should be, I feel like sensory is such it is, and I think I did a post about this, but it is so much more than a bean bin. And I'll like discuss that in my whole little spiel about that. But
yeah,
sensory deserves to have a course like that.
Oh, yes. So even after going to this course, well, the reason why I decided to go to this course, because when I transferred over to working in the school setting, I knew that was an area that I just had kind of basic knowledge. And so the more kiddos that I was seeing, I really wanted to understand and get a good understanding of what was going on with them, and then get some really good treatment approaches. And like you said, more than just maybe a sensory bin and, using a scooter board and all of that.
And then being able to like fine tune your observations.
Yes, that is huge. And so
big.
They definitely covered that in the course. I would totally recommend this course. It was very comprehensive, and I came away with it with a lot of good ideas and things that we're already trying to implement. And so that is really exciting, because sometimes you go to a course and I don't know, the instructors say you take away maybe 10% or 20% of what you learned in the course, but I feel like I took away so much more than that from this course. But still,
because sensory is so interesting. And like when, I don't know, at first, I don't know, this is just me, but at first, I guess I probably was the person that thought it was just sensory is just like tactile play. It's, you know what I mean? It's just a bean bin. But I mean, there's so much that goes into it, and I kind of like it. I think it's fun to put your detective hat on, and then you can develop so much just by observing the child in play, or at recess, and you can kind of gather some hypothesis of what is going on. And I know that there's some research like, okay, is it sensory or is it behavior? But for me, I'm like, the way I kind of see it is that, sensory could be a motivating factor to certain behaviors, because I believe that behaviors happen for a reason. And it's kind of our job to interpret what they're doing and to figure out and, build our own hypothesis and look at how they're functioning, how they're moving, how they're playing, how they're interacting, and be able to kind of see, okay, what is the underlying sensory system that could be affected?
Yeah.
And that is fun, right? And I feel like as our team has kind of learned more terms, because I mean, it's tricky. And then when you're explaining it to parents at IEP meetings or in the clinic, it's sometimes you're having to explain it in a way that isn't sound like, okay, like, wait, what are you saying? Like, you know what I mean?
Yeah. And it gets, there's so much to even explain, because there's more than, most of the time, there's more than one sensory system that's affected in one way. And that makes it just so complicated.
And and then it's like, okay, well, is it driven by another motivating factor? Is it through, is it a tangible item that they're wanting? Are they escaping the task? Or those types of things. But I'm so glad you guys went, because that seemed like it was a really good course to go to.
Yeah, it was a really, really good course. Definitely would recommend it, and hoping to take.
And this is your fourth year?
In the schools, yes.
Fourth year in the schools.
Yeah. So, I mean, going back to when I first transitioned to the schools, I remember talking to our manager and just thinking like, okay, I feel like I need to take a lot of continuing ed right now. And his advice was like, well, just start practicing, start kind of seeing what you're seeing with your students. And I started with taking Handwriting Without Tears course.
Which we love.
Oh, yes. Totally.
I love it.
I do too. I talk about this all the time too on my Instagram. I use it in school every day, and then at home with my daughter.
Exactly. I think it's so fun. And In fact, I just posted about it today too. Like they have so many really good resources for practitioners, for parents. I love the multisensory approach, like with the songs and the manipulatives. They're so fun and the kids love it. They have a good time with it. And it like it's so easy to understand and why certain things are put into place. And I like how everything is very purposeful in that program.
Yes. And I mean, once you start using it, so I took that first course and then I left that course feeling like this is an amazing program and they have several courses that you can take. So I've taken all the courses leading up to trying to get, or, going to get my certification. But I just
Which is huge because I feel like, oh my gosh, that is so needed. Like, I feel like everybody needs to get like a refresher every single year on that. It's such a good program.
Yeah, it's a really good program. And what was I going to say? Lost my train of thought.
Sorry. I like to interrupt, so it's totally my fault because I interrupt all the time. Like, I'm just like...
No, not really. You're just adding.
No, but it is. It's such a good program. And the way I see it too is everybody should, like, parents can be trained by it. Teachers can be trained with it, because if we're seeing a kiddo, for 30 minutes a week, and then we are recommending that they, form the letter from top down, left, right, and then potentially transition at home, and then those behaviors or those recommendations aren't carried over. Now these kiddos are developing a lot of bad habits that could potentially be ingrained, so it just makes it trickier and harder to.
Yeah. And I mean, handwriting is so important. And nowadays, I mean, I don't know if everyone still feels that way, that's maybe not in the school setting or a therapist or a teacher, but handwriting really is important to a child's development. And for parents to understand that when a child is handwriting, it's activating different areas of their brain compared to when they're going to be using a keyboard or an iPad. And so there's research, there's studies on the learning
or
without tears.
Yeah,
or a whiteboard. There's research out there that's showing that is true. And so handwriting is very important. And a child's expected to handwrite, throughout their whole school career. And so if that's a struggle for them, then that can affect other areas, and like we see it all the time in schools right now. So it's a fun program that I would recommend to parents and teachers and
educators
OTs
and all. It's a really good program. It's fun to go to those courses too.
Yeah. And it works. So like seeing the progress in the kiddos that I use it with, like my students, it's awesome. And that's the most important thing. It works and the kiddos have fun when they're doing it, and you have fun when you're, singing the songs with them. And
like the Matman, Magic Sea Bunny. Like there's so many, like we added a bunch of props, which I think, we can post about it again. But that's that's a good course to just, take away a lot of information. That's another course where I felt like I took more than like 10, 15%. You know what I mean?
Yeah, it was,
I loved that course. So like for me, when my first course, let's see, what was it? I'm trying to think back.
So right out of school. So the first 2 years of being an OT.
So first, again, it was, it was kind of, when you walk into the setting as a new grad and you're like, okay, well, there's so much to learn, right? And there's like, you're just trying to get the grasp of even just being a therapist on your own. Yeah. And so again, my boss said the same thing, like kind of get a feel for it and then just start, with whatever you're interested in at first. And so at the time I had went to the alert program training, which the zones of regulation was also based off of the alert program. It has some components in a sense where the alert.
Sorry, go ahead.
Oh, no, it's okay. The alert program was in San Francisco, and I remember being like super excited, and it was such a fun training as well too. And they had, different self-regulation tools, and the alert program basically is a program that discusses a child's overall level of alertness. So whether their engine is running too high, too low, or is it just right? And I felt like oh, okay. It kind of made sense. At first, when I was treating some kiddos, again, total new grad, had no idea, like which way to go as far as like, what I needed in training. But it gave me like, I guess like a foundation to understand that, there's always a reason for behavior. There's certain things that could be happening. And, if the lights are completely dimmed, in the classroom and then you see Johnny, falling asleep, like, well, why? And those types of things are basic things that as a new grad, I had no idea, like the correlation to it.
Yeah.
Because in school we just get like a brief explanation of all of that. And I think I've talked about that in the previous podcast that, peds wasn't a strong area initially. And then the more that I started to learn, the more I started to love it. And then working with the kids are so much fun. Yeah. So, but that was my first training. I loved that program. And
I haven't taken that.
It's really fun. And the presenters were amazing. They're fun. And like I said, they had, tons of examples of different tools and fidgets and everything you can possibly think of. And they explained it. They let us test it throughout the training. And,
good.
I don't know. I took a lot from that too.
Yeah.
I felt like that was like my introduction to sensory in a sense. But yeah, so that was my first little training.
Okay. So I have to think way back to my first training. Okay, so I was working with adults at the inpatient rehab hospital, and I was split between, the hospital was divided into different hallways, so they would kind of group patients together. And so these were the patients who maybe were in the acute hospital and they weren't quite strong enough to go home. So they would go to inpatient rehab for like a short stay. So I was split between the hallway that would hold the patients who had spinal cord injuries, and then also the patients who had brain injuries. And so
this is where I met Shannon, by the way, because I was a rehab aide. And she was an occupational therapist. And I loved being the rehab aide with Shannon because she would explain things to me and made me understand why I needed to position myself in certain places, and which is so helpful, by the way. Like that was because I didn't know what I was like. Oh, I don't want to mess up your treatment,
Yeah.
or do too much or do too less, you know.
Because it can make a difference. So that's why it is important. But so I took a Neuroifera course, was my very first course that I took. And that was, it was a lot. So Neuroifera is going to be a treatment approach for patients who've had like hemiplegia from a brain injury or stroke. And so the first course that I took, it was I think it was called Resolving Shoulder Impairment. So it was all about the shoulder. It was, not just shoulder, upper extremity. And it was a lot in the 2 days. It is a very intense course. Have you taken one of their courses yet?
No, I haven't. But while I was there, so there was a physical therapist that worked there and an occupational therapist that worked together, and they were like the team. And in my eyes, when I was a rehab aide, like they were they knew Neura for no other, and everybody respected their work because they understood the body, they understood the movement, and they had a lot of knowledge about it. And now we work with the occupational therapist in the school setting, which she's an amazing therapist. And, but I remember seeing what they were doing, and it was amazing to see the progress that some of the patients had. I mean, they would come in, and some of these patients were so involved that they, had limited movement, even in bed mobility, and being able to sit at the edge of the bed. So, to see where those patients had started, and then boom, as they were working with them, now they're walking down the hallway. I mean, they had so many different really, really interesting manipulatives, but both of them taught a lot. Well, they were, this is why,
Yeah.
You know, certain things are happening, or, you know, when we're documenting, this is what we're looking at. This is why we're saying this. And so I feel like that was really, really great. And I
Good
love, and I try
learning.
to do that too. Do you feel like do you still try to do that if you have a rehab aide?
Oh, yeah.
And like if I am working in the acute rehab hospital, which I still work there per diem, and I have a rehab aide and they're going into school to, you know, to be their physical therapist and occupational therapist, I like to talk. I'm like, I mean, if you want, I could totally explain some of these things, but
Yeah.
yeah, it's interesting.
It was so
interesting.
I think that's why, I mean, I was around some therapists that I definitely respected, and I saw they were making huge changes in their patients. So I definitely wanted to take that course, but you know, to
and the
be
physical
honest,
therapist, sorry, she still works with, what's his name? Waleed? Right? Okay.
Yeah. The creator of Neuroifera. Yeah, she's an amazing physical therapist. But yeah, so it was a lot. I'm glad I took the course, but I will be honest, you know, this course you were expected to know anatomy, like, so we were doing the whole upper extremities,
like the insertions and all of those types of
yes.
things.
And that was not a strong area for me. I knew it, I knew it in school, but I didn't have every muscle, memorized, and it's not expected in that course, but it would be very helpful if you knew that. And so it was really like overwhelming
and everything.
Yeah. So it was a lot. So much so that when I left the course, I was done with the course, I was like, okay, I took away some, and then I continued trading with those therapists that, we're talking about, but I ended up taking the course again.
Good.
The same exact course.
Just to kind of, that's what I was just going to say, because I'm like, there are certain courses, which I'll kind of talk about in a little bit, that I wish I can take now.
Yes.
And then be able to like see it from a different perspective, but go for it. Sorry.
So someone had asked me, like, Shannon, didn't you take this course already? And I, without hesitation said yes. And I'm taking it again because I feel like now, I think it was now probably 4 years later. I understood a lot more. I was able to take a little bit from what I originally learned, and then started, thinking like, okay, now I'm understanding some of this, take the course again. And it was almost like a little light bulb kind of went off. And I'm like, okay, so yes, I totally agree. Taking a course a second time, especially if it's something that, maybe you felt like you weren't quite ready for, like in my case, or it was really something that you were really passionate about and maybe wanted to, take the course again and see it in a different light or take more from it. Like
after you work in that setting.
After you start applying it.
Yeah. That's
definitely
really good advice.
Can take it again. Yeah.
No, and so my next course that kind of like is very similar to this situation. So my next course was with Mary Kawar, who... Like,
I want to take this.
Oh my gosh. Like I just want to be just like her. She's amazing. And
so I had never heard of her until you told me about her.
Gosh. And I just like she was like in between, like, restroom breaks and all that. She was like just doing random things and showing us random things. And then once we all like regrouped, she would explain, like, she was just nonstop giving us everything that she knew. And it was one of those things where I'm like, gosh, I just really want to be like you when I grow up.
Just a really good instructor. So what's her
super good instructor. And I was again a new grad, and I decided our boss brought her into the clinic to be able to train the entire staff. And it's one of those situations where I'm like, okay, I had an idea, like, okay, vestibular movement. At that time I was...
So what's the course?
It is, it was about astronaut training and primitive reflexes.
Oh my gosh. Okay.
And at the time, like I mentioned, like in school, we get a basic understanding. Okay, vestibular movement, right? Yeah. Like, but this course was just going into full detail of the vestibular system. And it was one of those situations where I was like, okay, after the course, I'm like, okay, that's really cool. And, I got bits and pieces because it was so much good information.
Yeah.
But at that time, I didn't fully understand it the way I do now.
Yeah.
And so Oh gosh, I wish I want to take it again just so I can like, then you can ask like really like
Oh yeah.
intensive questions that you may have. But
What was helpful for me, I think you had done just a little mini in-service, like a recap of that course after you had taken it for the rest of the staff
yes,
at the clinic. And so
and
that was so helpful.
yes, and I, like kind of what we're talking about, like, just apply it in your sessions. So after I took that training, my boss, we kind of wanted to, not trial it, but we wanted to see kiddos in the clinic more intensely. So twice a week for 60 minutes. This is a while back, and we saw them for 20 weeks and we tested them, how they were doing with like, the motor coordination, how they were doing. I think we gave the VMI, and then we tested them afterwards just to see like any progress. And so
is that how long the program's supposed to be implemented for?
No, it isn't.
Okay.
We just kind of we just wanted to see, and there was improvement in self-regulation.
Already.
There was improvement in bilateral coordination. I mean, there was so many good things that came from it when it was applied really intensely, and it was such. I felt like that's when I really started to like something clicked. Kind of similar to you. It was like, wow, if I put them in this position and I give them this sort of vestibular input, what is that doing to their eyes? What is that doing to their body? What is that doing to their, parasympathetic system? What is that doing to their sympathetic system? That's kind of, there's so much that goes into it. And it was one of those moments where it just clicked. And then after that, as I started researching and doing a lot more with the vestibular system, and I started to understand it a little bit more, now I wish I can go back and take that course again and then be able to like, because I have some questions that I'm like, okay, let me do some more research, but I would love to be able to pick her brain,
Yeah.
And at that course, she also briefly described primitive reflexes. And that was something that at that time, again, I was a new grad, had no idea that those could be retained.
Yeah.
And I had no idea how do you even mature, how do you integrate, how do you mature it? And it was, I want to take that course again. Let's take it.
We should, because really after you had given that in service, that was really interesting, but really kind of hard to apply the treatment approach. I mean, for me, I want to feel really comfortable in that. So like going to that course would be helpful, but you also did like one-on-one training with me with, how to utilize the program with the student, which was
in the school setting.
Helpful. Yeah. So helpful for me, to have that support from you in that, but I would love to take that course.
Oh my gosh. I loved it. And it was so funny because I was like the guinea pig in that training.
Yeah.
So not a guinea pig, but she basically like had me, do all, and I loved it. And I felt so regulated afterwards.
Yeah.
Like I'm like one of the like vestibular seekers. I'm like curling my hair and I'm swaying side to side. So when I was on that board and she was like, demonstrating the movements and all of that good stuff with the music, I was on the board and then like, I swear it was, I love that course. It was so great.
Oh my gosh, I'd be nauseous.
Well, it was so funny because a lot of people, even just looking at that.
Yes. Watching
somebody spin, it was like, some people were like, I can't watch it. They had to turn away.
Oh yeah.
But that was one of, we have to look into that.
Yeah. I think one thing that's really helpful at least for me, and it was something that has been required at my previous, my two previous jobs, when you take a course, it was expected that you would come back and share that knowledge with your colleagues just do either a mini in-service, put together a small presentation, and just doing that helps kind of solidify what you've learned. And that's always been helpful for me. And even to see, when someone else comes back and gives, like you did that in-service, to kind of say, oh, I didn't even hear about this course before. This is really something I, would want to do for myself. So that's something that, not everybody likes giving presentations. And I'm always kind of like, okay, I get a little shy and I don't, really,
No, you don't.
It's not my favorite thing to do. I'll totally do it. And once I'm up there, I'm fine doing it. But
well, you're so good at it.
as much as I feel like, that gives me a little nervous feeling inside, it is really helpful. It's been really helpful.
And I agree. Like when I did that mini like in service, it was really helpful because like I don't want to be all dramatic, but I have so much respect for like the vestibular system. Like I love all sensory systems, but the vestibular system I feel like is like, I just love it because there's so much that goes into it. And I'm like, oh, every time I read something, I'm like, that's interesting. I didn't know that.
Yeah.
And so I really, after that course, I, when I started to apply with my clients and I started to see the outcomes, I wanted to know more about it because that's just me by nature, right? I'm totally nosy. I want to know everything about that. And so, I started to try to understand because I'm like, okay, what the horizontal, like semicircular canals, like how does the posterior, anterior, all of that. So we'll go into a little bit more details later on about the vestibular system because I feel like that could be a potential, like, I don't know, 5
long
episodes. I'm like, this is episode 20 of the vestibular system, you guys. No, just kidding. But I really feel like the vestibular system is such an important system. And so anyways, I ended up making like my own model, which I will be posting about. We will be posting about.
It was so helpful.
And
just
it still is. And I
Yeah.
still have it. And I'm totally going to make another one and I'm going to post about it because it is such a good visual to have when you're doing those types of in-services or even for yourself to understand what is being activated in certain positions, why, and you know what I mean? And so... Yeah, that's my whole spiel. I don't want to give too much, but I just,
I remember, I think it was maybe, I don't know, 8 years ago. I ended up getting Bppv. So
that's right. I remember that.
I can't remember exactly benign proximal something vertigo. I can't remember the exact full term because we never really use it, but Bppv. Yeah. And so, so dizziness when I would turn my head to the right, and I had it for months, and it was crazy how when that system is off, how uncomfortable I felt, nauseous, and just not feeling right. So kind of going through that experience definitely made me appreciate that system. And when it was resolved, oh my gosh, I felt so much better. But just thinking about, anybody, kiddos or even adults who deal with vertigo or have,
they've had a stroke
or anything where that vestibular system is, any system, but especially that, that was not.
Oh, it's not, it's definitely not fun. I know, like my husband is like, he gets car sick and my husband is 6'2". And I always tell him I'm going to put him on that astronaut board. He's like laughing. I'm like, yeah, just wait. I'm like, I can totally help you.
I can realign those crystals.
Right. No, and it's so funny. But yeah, we'll talk later about the vestibular system. But, again, I was a new grad. When I took those courses, and it can be super intimidating. You can be like overwhelmed at first because you're like, oh my gosh, you can, sometimes you'll sit there and be like, I need to learn a lot.
Yeah.
But just know that, I felt like that. You feel like that. I'm sure everybody feels like that when you take your first course because you're just kind of getting your feet wet. You're just introducing yourself to the scope. And I feel this is another reason why I love OT is because I feel like when you think you learned it all, like there's always something more to learn and it just gets better.
Yeah.
That's the way I see it. It just gets better and better and better. And there's always something to learn and
or take a course again. And
exactly.
Yeah.
Like we really need to look into that. Let's look into that. So that was one of my first experiences what was my most recent? Oh, hello. I did I'm taking the USC course on sensory integration. So I've had experience, like I've mentioned before, in the clinic setting where I did true sensory integration. And I currently work in the school setting. And I also worked in a psychiatric healthcare facility for adolescents. And I can that's another podcast that we can talk about. But I really felt that I love sensory so much. And, initially you don't really fully think of sensory being applied to a psychiatric healthcare facility.
Yeah.
But there was a lot of research that, show positive outcomes and all that good stuff. So again, I wanted to learn more. I always love reading about the sensory system because it's so in depth, and I feel at times it's really tricky and challenging to be able to do true SI in the school setting. And at times it can be misinterpreted a little bit as far as how OTs can approach sensory and whatnot, but there's so much that you can apply if you're, if you have the equipment and whatnot in the school setting. And so anyways, I totally talk a lot, you guys. But I wanted to learn a little bit more because even now as a practicing therapist, I don't feel like I know it all, but I always feel like there's room to learn. And so I wanted to take a course and learn a little bit more about sensory integration and observations. Again, I feel really confident in my observations. I can look at a kiddo and be able to gather a really good hypothesis of what potentially could be happening. Or I can look at a kiddo as they're playing and be like, this is probably an area of challenge. And sure enough, when I ask the teacher, yes. Yeah. So that's something that didn't happen overnight. No. And it is still something where I'm learning every single day. So I'm starting to take that course, and the last course that we took. So it's an entire program that I'm taking through USC.
Yeah, that's a long one.
It's a long one.
It's worth it.
It is. It's really, really thorough, really good. They give a lot of examples. You're having to observe kiddos on videos and being able to kind of gather your information there. So the first course of that entire program talks about the theory, and I love all that stuff. And then the second course goes into a little bit more details on evaluation. Which is cool because I was able to get a lot of information on the new sensory assessments that were coming out. And I'm sure you heard a few, right?
Yes,
at your course. Those. Oh my gosh. It's so nice because I feel like it really gives the sensory system the respect that it deserves, especially, we have really good questionnaires that we're able to give out, like the sensory profile or the sensory processing measure, the SPM. However, to do the SIPT in the school setting, it's, almost impossible to get to carry around that huge luggage, and it takes almost 2-3 hours. I'm not certified in it, but I've heard that it's a super long assessment. It's still really good, and you're able to get a lot of information from it. But, the fact that the EASY's coming out, I know there's a few other that you had mentioned that was in the USC course as well, too.
Yeah.
I can't think of them at the top of my name, but we'll talk about that at another episode. But so there's so much that I even am still learning and that I'm trying to apply, and I'm like, okay, how can I revamp, evaluations, how I'm writing it and how I'm interpreting it and how I'm explaining it to parents, because, sometimes if a kiddo is having a lot of challenges with sensory processing, during my evaluation in the school setting, I'll do, depending on the age of the child, depending on the child's ability to follow directions and whatnot, then I will either do more structured observations or unstructured observations based off of what I kind of feel that the child is doing. So anyways, the past USC course gave me a little bit more, I guess, tools to be able to use for evaluations to fine-tune my observations, which is really nice. And, some of the things were review, but some of the things were really, I'm like, oh, I didn't, that's a really good way to explain it. So I guess an advice for any practicing therapist, if you see a sensory course, don't be like, oh, I already know that, I'm not going to take it, because there's still always something that you can potentially adapt, or you can hear how another therapist is explaining it or writing it, or how they're observing, because there's certain things that I'm like, oh, I didn't even think of to observe, A, B, C, or D that way, which was helpful to me, because I'm like, okay, that's another thing that I can put in my toolbox.
Yeah.
Yeah.
That's another
of tricks. Yeah.
Yeah. That's another good takeaway that I try to get from my courses is just hearing other therapists ask questions, and we, sharing in that conversation about the topic, whatever topic you're learning about. And I just always write those down. I have like a separate page in whatever notebook or whatever, and I'll flip right to the back and try to keep track of some of those. Because a lot of times
that's really good advice.
And a lot of times they're the questions that I'm thinking of, and I'm maybe not going to be the first person to raise my hand and ask the question. Like you probably would just, raise your hand and ask. I always feel a little more timid and shy. And so I'll be the one.
I told you, I'm nosy and I want to know everything.
I'm the one who like waits till the end, like close to the end. And I'm like, okay, I'm going to ask, separately, because that's kind of my comfort level. Yeah.
That's really good advice, because, when you go to these courses, and it's kind of like you're sitting there and, you're gathering everything. You're like trying to process it. You're trying to figure out who you're going to apply that to.
Yeah.
And then some of the questions, a lot of people, because everybody's kind of having those same questions. It's tricky.
Yeah.
Sensory is super tricky. And another takeaway that I think for me has been helpful is being not brave enough to try the interventions, but try the interventions that you were taught, trial them, get a feel for it, get comfortable.
Yeah.
Like the way when I mentor some therapist, the way I say it, I'm like, try it, trial it, figure out what feels comfortable to you and how you're evaluating, try to explain it to yourself, try to interpret it, try to build a hypothesis, but try.
Yeah.
Because if you don't feel comfortable about it, that's fine. That's a normal reaction to not fully knowing, and not feeling confident with the sensory system, but try it.
Or anything new.
Or
really,
anything
right?
new. Yeah, that's true. Anything new, but try it, because, once you start to see, it'll be a click. I don't know. For me, it was kind of like the same thing. Like there was a click.
And it's really hard. It's hard to go to a course on a newer topic, or, maybe a topic, like you said, that you're not comfortable with, and then coming right back into work and then implementing it.
Exactly.
It's hard to do, but, really, you really should try to do that. But
during the course, already have a kiddo where you're thinking who you could apply it to, potentially ask the instructor, about the kiddo, and then most likely, more often than not, the instructor will be able to like state certain things or give you some ideas or some tools that you can potentially use. Take that back and definitely implement them and try it.
Yeah. And that's why I like trying to team up with coworkers, because I don't know, I just feel like
then
it's
you can like talk about it and bounce ideas off.
Yeah. And like, so when I had taken that Neuroifera course for when I was working with adults, I knew that there were other therapists there that I could reach out to. I was trying to implement these things, and, it can be a little overwhelming because you're changing a little bit of your treatment approach and maybe something you're not fully comfortable with, but having that support there, is really key. And just like you said, just being brave enough, just taking what you learned, even if it's not everything, just one or two. Yeah. And just implementing it.
No, that's really good. And what I love about our team is that whenever we have a really challenging like case, and we are like, oh my gosh, I don't know, it could be this, but it could be this. Yeah. It's so helpful to be able to bounce ideas off of one another and to be able to like, problem solve together. That's what I love.
Oh yeah. Definitely.
I love when we do that.
Yeah.
It's like, because sometimes I may see something, sometimes you may see something, and, to be able to, a lot of times too, I ask like, okay, well, how did you write that? Or how would you write that? What do you,
I agree. Yeah.
I love that.
That support is crucial.
Super crucial.
Yeah. I think that was one thing I was looking for when I took my first job after OT school, was really finding a position that in the interview process we had talked about, that I would have that mentorship, because I didn't want to be just thrown out there on my own. I wanted that reassurance that, I would have some kind of mentorship, and that's the reason why I ended up accepting my first position, because I could tell right away just from the interview process and meeting the other therapists, they were going to be really supportive, and they were. So that's so
And then
key.
they can even tell you which, courses you should be taking and help guide you based off of what you're interested in and where, you'll have a mentor that they'll be able to give you some advice. Hey, you maybe this course would be really helpful to you. And being open to that criticism and not take it in a negative way, because sometimes your mentor will see things that will only, how do I explain this? But basically they'll try to see things that you may not know that you may need support in.
Yeah.
And they may point it out, but give you really good guidance on how you can become stronger.
Yeah.
And how you can become a little bit more confident in certain areas. Yeah. Which is very helpful. Mm-hmm. I don't know. Yeah. That's a thought.
And one other thing just popped in my head. I always try to get the instructor's contact information.
I know. That way you can stalk them. Just kidding.
It's so helpful. I've
emailed and I've asked for okay, do you have any resources or any articles or, anything?
Yeah. And they're always open to share. I mean, they've accepted that position to educate and share, and they're more than willing to help.
And the thing is too, is there's limited amount of time that courses are. Yeah. And oftentimes they're only getting a snapshot of what they, the tools that they have. And so oftentimes when you're emailing them, they're like, oh, there's this other resource, or there's this person, or, they have different contacts that they can potentially give to you.
Yeah.
So that's really, really helpful. So anyways, what is your next course that you're kind of interested in taking?
One course that did pop in my head that I want to mention, that was really, that NDT course that we took.
Oh my gosh. That is a good example.
So that course.
We took that how long ago?
Okay. So I was pregnant, right? So it was
with Izzy
5 years ago. Yeah. Mm-hmm. Because I was still working at Children's.
So Shannon was pregnant and she was eating saltine crackers because she was so nauseous.
I organized that course.
Oh my gosh.
I had organized it because I wanted to take an NDT course so badly, and there wasn't any around. And so I had done the back, my manager at the time was like, okay, well, let's see if you can bring the course to us. So I did all the emailing. I set up the course.
Oh my gosh.
Yes. And then with my first daughter, I was so nauseous. The first trimester, I was nauseous
I was too.
Every single day.
I took those terrible. Prego Pops. Did you get those? Were they?
I did not use those.
Oh my gosh. They were oh my gosh. I was always popping one in. Literally, they were so helpful for me because I was so nauseous too.
I feel like nothing helped me. I don't know.
I know you had it a lot.
Bad.
Yeah, a lot worse than I did.
Yeah.
So at that course, she had saltines, and you were only able to eat peanut butter and jelly sandwiches.
I think that was it.
Oh, you poor thing. That is so hard.
Yeah, that was kind of like a fog, but I did learn a lot.
I think all pregnancies are fog. I'm I don't even remember that first trimester. Literally, I found out I was pregnant on Father's Day, which is kind of funny. I'm totally going on a total tangent, but I found out I was pregnant on Father's Day. My husband comes home from work and I'm like, happy Father's Day, but that whole summer, I don't even remember because I was asleep the whole summer. And I'm like, I had all those plans. I'm going to garden. I'm going to, organize my toy bins. And I slept that whole, and I was so nauseous. But anyways, beside the point. So back to the course, NDT course.
Yeah. So that was the course on, I don't remember the title of the course, but it focused mainly on posture and core. Yes. Right. And so that was a great course because everything comes down to the core, right? Mm-hmm. So that was a really good course to implement when I was working in the hospital in rehab, and then going back, really good to implement if you're working with adults. So,
And when I took that course, okay, so that was 5 years ago. So that would make me a 3-year-old therapist. And I felt like I was sitting there and I'm like, oh my gosh, like it was not all, I mean, of course, not all of it was going over my head, but I was super overwhelmed. I was like, okay, I understand this. I get this, but I don't understand this. You know what I mean? So that's probably another course that I can totally take over again and feel.
Yeah. Feel like there was more to take away or
there's more to learn, but I
Yeah.
just didn't have that experience yet.
Yeah.
Yeah,
I just feel like that is a really good one for most therapists, no matter what. I mean, that was pediatric focused, and if they had an adult focus, that would be good too, because it all comes down to the core.
Yep.
And, I remember we have a therapist that we worked with at the rehab hospital, Joyce.
Oh my gosh. This therapist is so cute. In fact, I don't even know where it's at, but I know it's one of my toy bins. She gave me so I went to school and she gave me this like little stuffed animal brain cell. And she's like, I want you to learn everything. And I'm like, oh my gosh, she is so sweet and such a good therapist.
She's a really great therapist. So one thing I learned from her, and I would always watch her. So like in the rehab hospital, we were treating in one big gym. So you could look around and see other therapists, treatments, PTs, OTs. And that was really helpful.
Oh, yeah, super helpful.
I remember always looking over at Joyce, and no matter if she was working with a hip patient, a knee, whatever diagnosis patient that she was working with, she was always working on the core. She had, her training was in NDT, and she was always working with everyone, like, sit up tall, upright posture. And oh
my gosh, I could totally hear her too. Can you hear her?
Yes.
I loved her.
She would always have, either like the figure 8 or a gait belt wrapped around, like pulling shoulders back.
Oh yeah.
And you'd always hear her, if she was walking with someone or sitting with someone, sit up tall. And so that she kind of helped me start learning about how important that is. Before you're going to do an arm exercise, make sure that your patient is sitting up tall, and how do you get them to sit up tall? So that was a really good foundational skills to learn.
Yeah, so important. I mean, you think of even handwriting, right? If a kiddo is just slouched over.
Yeah.
I mean, they're
and looking at that,
exactly.
Right? Like having, like observing that. And so as a new therapist, I really didn't observe that until I started, hearing that from her, and she was showing me some tricks, and I'm like, okay. And yeah, this totally makes sense. But that was a really good course. That NDT course is kind of known for that.
Exactly. I'm like, I want to take that course again.
Yeah.
Well, let's take that again.
There's so much. We have a long,
we have a list, just constant learning, constant education. Oh gosh. No, that was a really good course, and that was fun.
Yeah.
I didn't know what I was doing though. I'm just gonna throw that out there.
We've all been there.
Right?
Yes.
Oh gosh. And see what other courses. I took a few courses when I was working at the psychiatric healthcare facility. That was a setting that I fell to love, and I fell to respect the population and to understand mental health. And I wanted to get a better understanding of just our place in that setting, because I mean, that's pretty much where we started. Mm-hmm. And as a profession, and at that setting, OTs were, no one really knew what our role was and how we supported. And, so again, I'm, starting from scratch, because this was a new contract to our company.
You did the new program.
And it was a huge learning curve and a really great learning experience. And so, in fact, I have one of the pictures from that experience. I will never forget that, because I felt like once we started to get a hang for what we were doing in our role in that facility, and I started taking courses about mental health and understanding just everything about it, and how sensory interventions, how we look at interventions through a psychosocial lens, was very eye-opening to me. And I felt like those courses even helped and continue to help me even now. So if I'm in an evaluation and I'm noticing a little bit of, nervousness, or if I see a kiddo's body demeanor, I kind of, again, I'm observing everything, and I have learned to adapt how I am responding, so that way I can promote the overall therapeutic process.
Oh yeah, that's
which
huge.
was so important, and again, that's kind of my thing, try things and then again, take courses and then implement them and try it again and learn again. But I took a lot of courses in mental health, and I still research a lot about mental health and understanding that we all need to promote a healthy lifestyle, and how are we taking care of ourselves will directly relate to patients as well too. So mental health is important.
Yeah.
And unfortunately, there's, with certain diagnoses, there's a negative stigma.
Yeah.
And in some of these courses, I mean, they explain all of that, that there's just so much to learn when it comes to mental health that I want to, let's add that to the list, but I want to take more, even though I may not necessarily be in a psychiatric healthcare facility with adolescents. It's still something that we can work on and be able to provide support in the school setting. We did feeding too. We did a few feeding courses.
We've taken the Zones of Regulation course.
Oh, that's right. Yeah.
I have taken
with Leah.
Yes. Yeah, that was a good course. And then I've taken some spinal cord rehabilitation courses. I've actually taken 2 because when I was working in the acute care or the inpatient hospital, I ended up working primarily with patients who had spinal cord injury.
And you were great.
So,
I will remember, specifically remember this patient, and you were so good. And you were so good.
Thanks. It ended up being, it's one of my, well, you don't want to say favorites, but it really is one of the areas that I just love working with that population. But I took a lot of courses to really understand how to help them, and just really helpful, because when I worked in that setting, I didn't have anyone to guide me really as an OT. And so I ended up reaching out to a physical therapist, that same physical therapist who is trained in the Neuroifera.
Amazing, you guys. She knows, she can be able to look at somebody walk, and just she knows the human body.
She's really good.
So good.
Yeah. So I ended up reaching out to her because I didn't have any, like I said, any OT that had, specific training in spinal cord injury. And so she was a huge resource to me, and she taught me so much. And so I had her as a support, took the courses, and
she used to be a teacher at Loma Linda.
Yes. So she had a ton of knowledge. And so she's like, Shannon, I don't know how much I can tell you from the OT standpoint, but there's a lot of carryover of what, OT and PT is going to do with the person who has a spinal cord injury, because you're working on teaching them how to move again after, either having paraplegia or quadriplegia or an incomplete spinal cord injury. And so they're having to learn how to move differently, and OTs deal with that as well. So she was showing me, from her end. And then when she would co-treat with me, she would say, okay, well, when I worked with the OT at Loma Linda, this is what they did. So she was able to take, that experience, share that with me, and teach me and just tell me about a lot of good things, a lot of good ways to get dressed, a lot of good ways to use a mobile arm support, how to teach someone to feed themselves again.
That is such an intimidating, it can be nerve-wracking to be able to work with patients.
Yeah. Yeah. I was very intimidated and nervous when I first started. So maybe we can get into that a little bit more when we talk about our first job experiences, because I have a lot to share about that. Oh my
gosh, you have so much to share about that.
Yeah, that was, but those courses really, really great if you're working with that population. And a lot of them are PT and OT based because there's a lot of carryover. So
that's really, really helpful. Any courses that you took as a mom? I took Feeding Littles. Have you heard of Feeding Littles?
I've heard just from what you've shared with me.
I love them. Okay, so as a new mom, not fully knowing what to do.
Yeah.
It's a learning curve, and being able to, how do you feed your kiddo and you don't want them to choke? All of those things were very scary, very real. But I knew that I wanted to introduce a lot of food, a lot of very nutritious food to my growing child to help brain development, and just overall development in general. And I have heard about that course on Instagram, and I kind of just started following them. I loved what they were putting out. Their content was amazing. And I took a course while I was on maternity leave and loved it. I still was, again, new mom, so I'm like anxious about every single thing possible. But I took it. I started to implement their strategies. And, my son at 6 months was eating real foods, and he started to, be able to feed himself and explore with a lot of different foods. So like,
That's
awesome. And a lot of people will see him. They're like, oh my gosh, he's eating salmon. Salmon is one of his favorite foods. And when he was little,
that's
like
awesome.
6, 7 months, and they give a lot of good strategies on cups and, eating utensils and all of that type of thing. But again, mealtime should be enjoyable. So they gave a lot of really good strategies to introduce foods, to be able to present things in a very, I guess, like non-invasive way.
Yeah.
And I loved that. I took a few courses online on my maternity leave. So I took like screen time. I forgot. There's so many different courses I took. Primitive reflexes in the school setting. I don't know, but a few random ones I took, like the green spam, the floor. Spin floor.
I think, a day course that I took that was helpful was like a wheelchair positioning course. Oh. That was really helpful.
And so Shannon is amazing as far as like, you're like our go-to when it comes to functional transfers in the school setting. We have a program in the school setting where it's, a collaboration between nursing and OT, but Shannon is able to really, you're so good at that. And, I have some experience from the acute rehab hospital in transferring patients, but you have so many more tools in your toolbox that,
I have more experience in that setting, but I also think that I've said this before, I'm always reaching out to whoever I'm working with on whatever team,
you
patient.
Ask great questions.
Yeah, and I probably ask a ton. Like I ask you questions.
You do, but no, but it's so good because that's how.
Yeah, that's how.
Because, well, I think OTs in general, like I feel kind of like your mind, as you're building a hypothesis and an intervention plan, your mind is kind of like, for me anyways, the way I can describe it is like, I feel like it's a ping pong, like just being like tossed around, and I'm trying to like problem solve through it and be the detective and figuring out what's really happening, how I can potentially adapt certain things to help that process. And so asking questions is important.
Yeah, I agree. And I think like I said, the physical therapists that I worked with at the hospital, like I would always ask them about transfers, and I actually had a transfer go not so good, and I ended up hurting my back. I strained a muscle in my back, and
while you're at the rehab hospital?
Yeah, it was
really.
I think I had been a therapist for maybe two or 2 years. And so, I didn't have a ton of experience with transfers, and I set myself up correctly, and I was transferring. It was a 2-person transfer. So I was in the front of this gentleman, and he was using a board to get back to bed. And the rehab aide was behind helping. And
oh my gosh, was it me?
It
Just
was
kidding.
Not, it was not.
Was that me?
I vividly remember this day, but yeah, he was very anxious, And so during the transfer, which I had, under control, he kind of lunged for the bed. And when he did, I kind of tightened up one side of my body and my arm. So he kind of like lunged and fell into my arm.
Oh, goodness.
And he was a larger man. And so I ended up straining a muscle in my back. And so I think it was like 2 weeks, and then I was out of work and then did therapy and came back to work. But that experience with that transfer is probably why I feel
so thorough.
comfortable with transfers now. And I mean, you've seen me walk someone through a transfer.
She handles it. And she really, what I like about Shannon, you're like, I think I've said this before, but you're very gracious when you're like the way so you kind of tilt your head and you're like looking at it and you're just like, you can see your brain, like just trying to figure out, you're looking at everything in the environment. And then you're like, okay, let's try it. And you're right there, but you're so calm. And I feel like that is another huge part that helps that process, because it can be very anxious. It can be very like, you're moving from one surface to another. So it can be, kind of scary for the patient or the student. And so for you to remain calm, and you're very thorough, you're very like, you take it very slowly, so that way you can ensure and build the confidence with the patient and the caregiver, or, the teaching staff, whoever is with that student. So
that's huge.
That's a really good learning take.
Right? Because it was probably one of the scariest and maybe not so good experiences at the moment when that happened, like hurting myself. But coming back from that, I mean, having it be one of my stronger areas. And so that's what, learning is all about, right?
Exactly. Bouncing ideas off of one another, and, asking, like, again, I'm probably going to sound like a broken record, but asking questions and just knowing that it may be intimidating to ask questions, but just know that we all do it. That's how you're learning. That's how you build confidence. And that's how you're able to become a stronger therapist.
Yeah.
And being able to develop your own skills until you can fully feel like now you can be the mentor in that area,
Yeah.
Because that's how we all are. Mm-hmm. That's how we all feel.
Yeah.
So that's really good. What else did I take? I feel like I'm probably missing a whole shebang full of.
Yeah, like a lot of one-day courses. I like to take 2-day courses if possible.
They have I did. I took the integrated listening system.
Oh, that's another one on my list.
I took it with my friend who has a clinic down in San Diego, and she is amazing. Like her and her mother are occupational therapist.
Oh, awesome.
Her mother is an occupational therapy assistant, and then she's an occupational therapist, and they, are so creative. I just can't even handle her. She's so cute, and she has her own clinic down in San Diego, and she's like right off the beach. And so she's totally living her best life. She's doing really, really good things down there. And anyway, so she always has like tons of resources, and she's like, oh, this course is coming. So she told me about that course. So I went down there and we took it. And that's another course where I feel like, oh, I can take that again. Mm-hmm. There's so much that you can get from there, and being able to understand, how music helps with balance and helps with attention and all of those things, and how it affects sleep. And
that's awesome. Yeah, that sounds really
sleep is another big one.
Yeah.
To learn about. I took a course with that, and just understanding, that it's such an important occupation that influences everything, obviously.
Yeah, and
everybody.
Yeah.
And
not an area that I ever really asked about. I don't think. Not until recently.
Yeah,
until you started really talking to me about it. And I'm like, oh yeah, that makes sense, but that wasn't my go-to thing to talk about. And now it totally is.
Oh yeah, it's so important. And, I use it everywhere. That's one of the first things that I kind of ask about, or I kind of want to probe about. And understand. And that again comes from taking those courses and understanding and reading and doing all that. But it was something that was a big area of concern at the psychiatric healthcare facility, which was interesting to me. So one of the supports at that facility was just to promote sleep, and how can we do that, throughout that entire facility was something that was a big area that we advocated for, which was huge. And then looking at it from a school-based therapist standpoint, a lot of people were like, well, we can't technically write goals on that, IEP goals, which is correct. We can't, but we still can evaluate it and address it because it affects the school setting.
Oh, yeah.
How they're preparing their sleep. And, if they're not getting a full night's rest, they're definitely not going to be on their A game when they're expected to learn and sit in their seat and do all of those things. So, yeah. I can go on and on. I'm like, did I even stay on topic? I'm like, I don't even think I stayed on topic.
That's a lot. We covered a lot of areas. I mean, we have a good amount of courses that we've taken combined.
Yep. And I'm sure we're missing a bunch.
Yeah.
I think we took I took a toy one. I took, just a lot of day courses.
Yeah.
I feel like I can teach the toy one now. Just kidding.
You can.
Oh my gosh.
The coolest toys.
And like I said, I post about it. And this is a little tip this is totally not even about courses, but this is a course 101 by Jenna. When I go toy shopping, I don't go with the intention to buy. I go with the intention to learn. So that's a tip, because I go into these toy stores. I go to a store and I look at all these toys and I'm like, okay. And this is I don't know, I'm so silly, but this is how my brain works. But anyways, I'll go into a store and I if I see a certain toy that I like, I take a picture of it. And then I'm like, as I'm walking around, I kind of think of different ways that I can adapt it, which is one of my strengths.
Definitely.
Is that strength. I can look at something and figure out 20 different ways on how I can adapt it and work with that same item, but use it for multiple purposes. Sometimes I take bits and pieces and parts from certain toys and I use it into my intervention, which is why my bag is craziness right now. And I need to definitely give it some love. But so I go into these stores and then I look online, I do my research and I figure out who is selling it the cheapest. And then if I really, really want it, then I get it and I kind of spread it out. So it's not like one whole, cart full of items.
Yeah.
But I have done that in the beginning of the year. I'm like, okay, let me go work at the rehab hospital for a couple of days and then I'll give myself a little treat. I don't know. I love it. I need to organize it because there's stuff everywhere right now.
And yard sales.
Oh, yard sales is a good one.
I mean, we've done that together.
Yes.
But
we have to look into that.
Yard sale. I think it's at the end of summer. But yeah, just yard sales, a really good place to find toys or any kind of random supply.
And your own kids.
Yes.
Your own kids. There's 3 toys that I'm eyeing for my son. And I'm like, once he grows out of that, that's mine. No, totally. And then right now I'm working on the pretend play kit. Okay. We should do a pretend play kit course.
You can totally do that. You are so creative and your ideas,
it's silly. It's so fun though. I love it.
Yeah.
Super
really
fun.
great.
That's another episode. We will go into details about that.
Yes.
So really excited. We totally explained that we are dropping a podcast launch and we are super excited. And I'm excited to be able to bring both of our knowledge and experience together and create this for everyone. We want to teach, we want to educate, we want to grow and learn together.
Yes.
So we appreciate each and every one of you.
Yes. Thank you.
Thank you so much. And definitely leave a review. Let us know how we're doing. And until next time.